Today we are going to see the next important topic in Unit 2, that is wearable cardiac monitors. So the learning objective is that what is the significance or importance of this wearable cardiac monitors. Then we will see key components of wearable monitors, that is the hardware components involved in that, and device types, different types of wearable monitors, and key applications, challenges, and finally future trends. So next we will move on to the empathy perspective of this topic. Why this particular topic is needed. So the wearable cardiac monitors is that by name itself, it means that we are going to monitor the record by means of wearing some sort of device over the body. So why this particular technique have come into the picture? What is the need? Why? What is the importance of having this technique? That is, we have to understand. So if you work on backside, from empathy perspective, there is a need of detecting arrhythmias. It's very much important in these days because arrhythmia is a very crucial thing that we have to give immediate attention to recover that, or else it will leads to sudden cardiac events. Sudden cardiac arrest to the people. Finally, the people may die. So that is the reason, and also it is an unpredictable one. Okay, there are some patients, they are asymptomatic. The reason is that the patient may not feel any symptoms, but at last they will end up with cardiac arrest. So in such case, if the people don't have any predictable pattern of symptoms, asymptomatic patients, that cases we have to go with this some device that need to monitor our body 24/7 without affecting our daily routine. So that is the demand which arise to have this wearable cardiac monitors in today's life. Okay, so because of that problem statement, we have brought up the solution, like we need a device to have continuous monitoring, and it should be a non-invasive, and even the clinician or the physicians, they have to operate the device on the other hand to see what is the status of the body, about patient body. So this is the reason the wearable cardiac monitors has come into the market. So what is the significance of early detection? Because the arrhythmias, if once it happen, there are very less chance to have the patient to be surveilled. So that we need to be direct at the early stage to avoid or to prevent so many things like life-threatening events or stroke or heart failures. So that is the reason we have to use the wearable cardiac monitors to enable the continuous monitoring, to have a frequent real-time data collection of the patients, long-term monitoring. Apart from that, patients going to the clinical settings on daily basis. So if you using this cardiac for wearable cardiac monitors on the in such case, it have given the results like nearly 85 percentage of reduction you can see in hospital readmission because of early detection of arrhythmia. So that is the improved outcomes you can see by using this such device like wearable cardiac monitors. So what are the technology or the features that we have in wearable cardiac monitor is that the very basic things or primary thing we can say, that is the electrodes or sensors, which is going to collect your physical vital parameters. Okay, so the electrodes which record the electrical activity, and we have so many sensors like accelerometers, gyroscopes, and so many things. So these things going to collect your body data. Okay, that is very much needed, which carries the information to for the doctors to help them to diagnose a problem. So once the data is being collected, that we have to be transmit. For that, we need a data transmission. Either we can use a Bluetooth feature or the GSM for remote access, or cloud for data storage for lateral reviewer. So these are the few key components that we have used in our cardiac monitors. And what are the types? We have a smartwatch type, a patches, a chest strap. Smartwatch already like normal watch, we can wear it, and it will keep on recording your heart rate normally by with help of the pulsation movement, that is your pulse activity. So another one is the patch. Okay, it's like kind of sticker adhesive type that we will place it on, that will stick it on your skin where you want to measure the heart rate. that will keep on recording continuous your ECG signal. The main important of using this that it is a water resistance. If you use the water, some may came with a water resistance, some may not. But if this one is 100% water resistance. So if you when you are doing your daily routine works, unfortunately, if you are flat, if you have any water, water drop on your patches, it will not interrupt your recording process. So that is the thing. We have replaced the smartwatch in place of, we have replaced the smartwatch by means of patch monitors. And third one is a chest strap monitors. That we will this chest strap monitors give high accuracy because we are going to place this strap directly over the chest, where you can see the heart, right? The exact location of the heart. So it will give very high accuracy compared to other two. So just we will wrap it over chest and we will put on our dress over that, and we can carry out our daily works without any disturbance or interference. So this is also very good type of continuous monitoring. Where mainly we can use it for physical activity and real-time monitoring. So what are the different integration that we can do it with wearable cardiac monitors to enhance the advantage or enhance the feature in the sense? First one is AI machine learning, so which mainly useful for prediction, okay, because this AI machine learning will help to learn the will learn from the data, given data. So from that it will start to predict and help in making decision what kind of problems or what kind of arrhythmia it is. And then mobile apps, the mobile app we can easily have the feature of data visualization, real-time alerts, and we can keep on track the patient's health profile also. So that kind of provision you can see in mobile apps. And IoT integration, so for remote monitoring and real-time data access over the certain distance or over the seas, where you have to go with IoT integrations. So finally we have the clinical application, we have atrial fibrillation detection, because the thing is that here the wearable cardiac monitors is exclusively for the cardiac related problems. So whatever the cardiac related problems that we can measure with the help of this. So one such is the atrial post-surgical monitoring, like after bypass surgery or any serious severe surgery we have undergone over the heart, that we have to post monitor after the surgery. So that is where you have to use the wearable cardiac monitors, whether the patient feeling any discomfort after the surgery, or if you can see any abnormal rhythms, or you can see any changes in rhythm, that will helps to see analyze with help of wearable cardiac monitors after the post surgery. And also it will helps to know whenever the person having very short of heart attack, heart rate and low heart rate, that is a bradycardia and tachycardia. That also we can need continuous monitoring. And finally it is a better or a best replacement for holter, so more comfortable compared to the traditional holder. So it obviously doing the job of holder. So holder is the thing that we're going to record 24/7, but the thing is that it has very less limitation of limitation of data storage. But here we have real-time data access because we have the feature of connecting whether Bluetooth or GSM or cloud. So wherever we can use it, okay, wherever by anyone we can access and use it. But limitation aspect we have to think about this particular wearable cardiac monitors. That is the main thing. If you see as a limitation, because accuracy concerns also is very important, because based on the motion artifacts, because after wearing this the patient is not ideal, they are carrying their daily activities, so the accuracy will get disturbed. And battery life, they are going to be a 24/7, then we have to work on the battery also. Data privacy, because it's transmitting from one place to another, storing in some data or some place, the privacy of data is very big question mark. Even some kind of breachers or hackers, potential hackers will hack that. So that we have to do regulatory compliance to meet privacy settings. And then finally the cost, the higher end devices with so many features, like higher end devices, it's very expensive, and the subscription fees also there to avail some sort of service, and accessibility issues for for all the patients also very big question mark. So these are the limitation over the wearable cardiac monitors. And then these are the future trends. And these are the few assessment questions related to this topic, like gate question and industry based questions that you can later check it out. And finally, this is the overall empathy map of, overall summary map of this particular topic. Thank you.